Well, very simply put, an eating disorder is an illness that's characterized by somebody's relationship with food breaking down. So that instead of having food as an enjoyable part of life, and importance to maintaining health, food becomes a feared thing, a frightening thing, and a source of problems for the person, to the point where it messes up their mental health and their physical health, and they can become very poorly. We reckon that eating disorders can affect about 1 in 50 people, and they don't respect age or gender. They can affect anybody, any part of society. And as I say, can have a huge effect upon a person's life, and indeed even get to the point where they might shorten somebody's life. So it's really important that we understand them, recognize them, and help people recover from them. Well, when people's relationship with food starts to break down, the kind of things that happen are that people will start to skip meals. They'll start to avoid eating in front of their loved ones and their friends. They'll start to perhaps over-exercise as well, and maybe change in other ways so that they become more withdrawn, less cheerful, more anxious, and overall, they seem to become very preoccupied, much more preoccupied than usual, with how they look and their body size and shape.
I think the most important thing is to make contact with people, such to reach out to your GP to talk about what your struggles are, because that early intervention and that early engagement is important to look at the symptoms, because often patients and their families can't recognise those symptoms, or they can be masked as something different. So by going to your GP and talking about what your problems are and what your struggles are and how something is affecting your life, that's the first port of call. They will then make a referral to the specialist local services and give you that support and reassurance, talking about the interventions that are available to you. Because obviously, locally, we have got NICE approved interventions, what are evidence based for mental health problems with good outcomes, giving patients, families that reassurance that there is a help available locally without waiting lists, with specialist services who are empathetic and understanding.